It's a new year, and with the new year comes new goals. What better time to focus on your health and well-being? With us today to talk about ways to have a healthy 2023 is Dr. Ann Kulik with LeBauer Healthcare at Horsepen Creek. So Dr. Kulik, let's jump right into it. Let's talk about preventative care. Why are wellness checks or screenings so important?
They're very important because frequently people only come to the doctor when they're sick or they're healthy and don't think that they need to come to the doctor. So doing your annual wellness check helps establish relationships with your physician. It lets us update your history and able to discuss screening tests that are right for you, help prevent disease, diagnose disease, and help you to lead healthy lifestyle, including diet and exercise.
So doctor, that takes care of the physical, but what about the mental? How important is mental health care?
Mental health is very important. It all comes together. Mental health can affect your physical health and vice versa. So it's very important to take care of your mental health as well.
So we're talking
some of the ways.
Oh, excuse me, I'm sorry.
So some of the ways you can do that are have network of friends and family around, keeping a healthy exercise and diet program so it keeps your mental health going. Seek help when you need to. Decrease alcohol use. Stay active, sleep well, keep lights on.
Good to know. So we've talked about the physical, we've talked about the mental. How can someone even know where to go for care if they're really just getting started on their healthcare journey?
A great place to start is at conehealth.com. There's a lot of links. You can schedule appointments online.
And why is having a primary care provider so important?
It's important because we take care of the whole person, not just individual parts and organ systems. We try to piece everything together, and we can help manage what we're capable of, which is many things, but then get you to the appropriate specialist if that's what is needed for you. So we look at the whole picture and help guide you for different vaccines you might need and different screening tests.
And speaking of those vaccines, how is staying up to date on vaccinations? How does that help folks have a healthy new year? Explain that, kind of expand on that.
So definitely staying up to date on your vaccines. We're still in the midst of flu season, COVID, of course, and pneumonia is a big one at this time of the year as well. So partnering with your primary care provider to determine which vaccines are indicated for you and the pros and cons. It's a team effort.
Very, very great advice. So hold on real tight. We're going to take a quick commercial break, but after the break, we'll talk about tips that will help boost your immune system. So stick with us. We'll be right back. And we are back with Dr. Ann Kulik with LeBauer Healthcare at Horsepen Creek. She is talking with us today about staying healthy in the new year. So, Dr. Kulik, a lot of people say they want to lose weight, they want to get back into the gym. How can what you eat impact your health this year?
Definitely eating a healthy diet. If you're eating too many of the wrong things, sugary drinks, too many sugars and starches, it can slow you down, make you feel dragged out. You need to eat healthy vegetables, fruits to keep your immune system boosted, keep your energy level up, and get your get your exercise in, releasing the endorphins, keeping moving.
So we want to keep moving. Just kind of expand on the importance of having that exercise.
So the guidelines are 150 minutes a week, and it can be broken up into 30 segments, 5 days a week. But if you're not capable of exercising that much, and sometimes we try to overdo it, especially first of the year, hey, I'm going to get back into the gym, and then you go too long. So little increments. If you're not very mobile because of medical problems, a minute several times a day. Walking, marching in place, punching the air. You don't have to necessarily go to a gym. Walking is easy, up and down your hallway, around the table. Anything to keep you moving, get your heart rate up.
A nice walk. That's what I love to do. Good 30-minute walk after work. So, during this time of the year, a lot of people are considering kicking habits like, smoking. Why is now a good time for them to stop?
It's always a good time to stop. It affects many health things, including lung cancer, heart disease, chronic lung disease. So, partnering with your primary care doctor, giving you tips on how to stop smoking.
And we've talked about going to the gym, watching what you eat. Talk about sleep. How can sleep impact someone's health? Because that's important too.
For sure. Lack of sleep leads to fatigue, and then the brain's not functioning right. Teenagers especially, they need plenty of sleep so their brain develops and memory gets imprinted. So we need to work on at least 6 to 8 hours of uninterrupted sleep at night. So not drinking caffeine within a few hours of bedtime. Don't exercise within an hour or two of bedtime because you got yourself all geared up. Don't watch scary movies or suspense thrillers, and you should turn off your electronics. Try to aim for 30 minutes to an hour before bed to sort of let the mind calm down and get you prepared to relax and go to sleep.
I know you talked about no caffeine before bed. Are there some other things people can drink or maybe take to help them get to sleep if they are someone that has difficulty getting to bed?
Some of the herbal teas can help, so doing those. Maybe melatonin, the data comes and goes depending on the year, how helpful that is.
Okay,
and if you're having a lot of problems, speak to your physician.
good to know. One of our last tips has to do with what to do in case of a stroke or a heart attack. What should someone do?
So definitely dial 911 and get to the hospital. Lost time is lost brain tissue and lost heart tissue. So if you're having any slurred speech, facial droop, more confusion, weakness of an arm or leg, those are all symptoms of stroke. Get to the hospital. Heart, pain or pressure in the chest, short of breath. It could just be heaviness, pain in the arm. Again, time is of the essence. You need to call 911 and get to the emergency room.
I have a question. Where do people often struggle when it comes to setting these new goals for the new year when it comes to their health? What are some of the obstacles that they usually run into?
So some of the obstacles are setting the bar too high to begin with. You need to take things in pieces and start slow and make minor changes and then start building up to major changes. Nice place to start, of course, is your primary care provider to help guide you along that path.
Thank you so much, Dr. Kulik. You gave a lot of great advice. I know a lot of us are looking to start the year off right and healthy, but that's all the questions that we have, and you can find a full recap from today's Q&A on WFMYnews2.com in just a few minutes. Click in the To Your Wellbeing section. We'll be right back after this break. Stick with us.